Hello, everyone. I really want to warmly welcome everyone at this presentation today. My name is Patricia Finn, and I am the head of the Department of Medicine. Just 1 minute about why we're all here today and the history behind it. This presentation is being supported and presented by our Department of Medicine Inclusion Council, also fondly called the DOMIC. So if you hear that name, you'll know what that means. The background for the DOMIC, just so you know, I'm actually not in Ireland, if you see my background, although I am Irish, has to do with really trying to address disparities, equity, and inclusion writ large. And when I first came as a chair, we noticed as a department that although we had a significant number of underrepresented minorities in medicine in our medical school, in our internal medicine residency, it was at a 6% percentage, which was, we felt, not appropriate. That led to a formation of a diversity and inclusion task force. And that goal was really inclusion writ large, to really reach a percentage was not the goal, but to really provide inclusion. And so the percentage of underrepresented minorities in our residency is at an all-time high, 35%, ranging at about 20%. But those are just numbers. They don't really talk about our principles. The other part, what I would say is in hand, is also thinking about the role of women in medicine as represented really by the seminar yesterday, the impact of women on medicine. And the third really important part is thinking about equity writ large, always in everything that we do. And that has to do with thinking about really affirmation of gender and inclusiveness in everything. That has actually led to the formation of what we are calling our DOMIC, that is ably led by Minju, who will be chairing this presentation today, and is co-led by Alana Biggers, but really it all stands on the shoulders of all of you. So with that, I'd like to introduce the co-chair of the Department of Medicine Inclusion Council. Welcome all of you warmly. This is a key component for all of us, and my heart and soul with each and every one of you, Dr. Minju.
Unmute. Thank you, Dr. Finn. Welcome, everyone. My name is Minju. I am co-chair with Dr. Alana Biggers of the DOM Inclusion Council, and I want to thank Dr. Patricia Finn again for supporting this program and a lot of the program that we've been able to bring to the university in the spirit of promoting and supporting an inclusive environment for everyone. I'm so excited about this session. We've been trying to have a session like this for, I think, 6 months now pre-COVID. And we've been finally able to bring our wonderful speakers together to do this 1-hour session. So I want to introduce both speakers today. Dr. Henrika McCoy is an associate professor and the interim associate dean for academic affairs and student services at the Jane Addams College of Social Work at UIC. Her research was predominantly focused on, or has predominantly focused on, strengthening the screening of mental health needs for justice-involved youth, examining the intersection of mental health and juvenile delinquency, particularly for African-American males, and the impact of violence on young Black men ages 18 to 24. Her research is influenced by her own personal experiences as a clinician working with children, youth, and their families who are experiencing a myriad of challenges. Dr. McCoy's research has been funded by diverse sources such as the Robert Wood Johnson Foundation, the National Institute of Justice, the National Institute of Minority Health and Health Disparities. She currently serves, if that's not enough, she currently serves as a director at large for the Society for Social Work and Research and as executive counselor for the Division on People of Color and Crime for the American Society of Criminology. And she is also on the editorial board for the Child and Adolescent Social Work Journal. So welcome. I also want to go ahead and introduce our second speaker, Dr. Joseph Day. Dr. Joseph Day is an associate professor and director of the Community Health Program at Governor State University. He received his doctorate of public health from the UIC School of Public Health, Division of Community Health Sciences, and is also serving as an adjunct professor, so part of UIC and a graduate of UIC. Having read through some of his work, Dr. Day actually has spent much of his career studying structural violence and implicit bias. I was reading through his master's thesis, which examined the relationship between physician bias and diagnoses of oppositional defiant disorder in young Black males. And he found that implicit bias is an important factor in how members of minority groups are diagnosed. This study was especially impactful in that it revealed that Black male children may be given a diagnosis as more reflective of cultural stereotypes than with real symptomatology. And again, I think that really leads to his current research as well, which involves the examination of adversity on children and young adults and the subsequent development of chronic diseases, including cancer, the use of opioids, underage drinking, tobacco, and other substances. So I want to welcome both our speakers for this exciting talk today.
So I'd like to thank Dr. Ju and Dr. Biggers for inviting me. I certainly appreciate having the opportunity to present and present with my colleague, Dr. Day, who I've known for a really long time and think is amazing. So I'm just pleased to have the chance to do this with him. We're going to present today. We'll do a little bit of back and forth. I'll go first, he'll jump in, and then I'll come back at the end, and then we'll, I believe, have time for question and answers. I'm going to go ahead and share my screen. And hopefully everyone can see. If someone can nod and say if you can see the PowerPoint that I have up, that would be helpful.
I can see it, yep.
Okay, great. Okay, so we're presenting today the racial caste system and its impact on patient outcomes. And so what I wanted to do is I think it's really important that people have context. So we're going to start off, I'm going to give a little bit of historical perspective, just a brief reminder of current events. I don't think I have to say a lot. We're all living in this current time, but it is important to think about how history influences our current times. Then Dr. Day will come in and present some facts, some real data, some information that you need to know to really understand kind of how your work should be focused with patients, considering the context. And then he'll share some what to do's, and I'll come back and do the same and discuss what to do and what not to do. So here's kind of the historical perspective and the overview of our current times. And you know, I did this because I think it's really important for you to understand that history often repeats itself. And so if you're living in this current time, it might not occur to you how this is really reflective of the 20th century. So if you look at what we have here, the Spanish flu happened, as most people probably heard at this point, between 1918 and 1920. We moved into what's called the Red Summer, that some of you may not be familiar with, the Great Depression and the Civil Rights Movement. And all of those really are kind of overlapping and related to each other during the 20th century. And here we are 10 months or 9 months into the 21st century. And we've really experienced a lot of the exact same thing during the first 9 months. So if you think about it, the first part of the 2020 might be really thought of as the 21st century confluence of all of these at the same time. And so Black people were disproportionately impacted during the 20th century with each of those events. And once again, they're being disproportionately impacted during the 21st century. And so I'd like you to think about this, that we're living really in unprecedented times that are really parallel to this last century. And embedded in that parallelism is really a snowball. It just kind of keeps rolling down a mountain, and it gets larger and larger with each rotation. And so if you think about history, it's the foundation of every person's life story. And that if you are an African-American person living in this time, you might be exhausted because perhaps you've heard about many of these events that happened during the 20th century, or you experienced them. And now here you are again, you're being reminded every day about how what you're experiencing now is mirroring what happened in the past. So why history? It impacts your clients, it impacts your patients, it impacts their family experiences, how they engage with each other, their interactions, even simple things like road trips. There was an article in the New York Times a couple months ago about how, because we're all living in this pandemic, many people are heading on the road. And for lots of people, that might bring back really warm opportunity or memories to think about. But if you're African American of a certain age, it reminds you of times when your family hit the road and you were afraid to hit the road, or you have to plan because you weren't sure what you were going to encounter. So If you lived up north, you were heading south, your family had to think about, where you're driving, where can you stop, where can you not stop? And those times aren't that different from now. And so the things that often for many people in our country bring back pleasant memories or opportunities, for Blacks don't often do the same thing. And it's important that you consider those things when you're having conversations with your patients or even with people that you just simply know. So I have this picture here of the KKK, and I purposely wanted to include this because, as you see from the headline, it says, "When Chicago welcomed the KKK." And this article was reprinted in 2015, but this picture is actually taken in 1920, and it was taken, with the KKK was revised in 1915. This picture was taken in Lake Zurich. It was taken at the home of the owner of the Chicago Cubs, the man who built Wrigley Field. And it was an awakening for the KKK during that time. And as we know, the KKK still exists. As we know, white supremacy still exists and is thriving more than ever. And this picture I want you to think about throughout this presentation, because this image should let you know how for many African Americans in this country, what they're experiencing and what they're thinking as they live their daily lives. And we may not have 12,000 KKK that we know of descending on one place, but they exist. And not only do they exist, but there are other organizations that exist that also espouse white supremacy and that really are invested in making sure that African Americans and other groups do not succeed in this world, and in fact, ideally don't live. And part of that is the state-sanctioned violence. So this is a map that was taken to show you how state-sanctioned violence and racial terror existed during the 20th century. You can see here in the red that, yes, it was concentrated in the South, but it also existed in the North. This is a very famous picture that some of you may be aware of. This was taken in Marion, Indiana. And I use this picture because not only is it popular, but I want people to think about the faces here. This is entertainment for the individuals that are standing here. Emmett Till, we're all here in Chicago, so hopefully everyone recognizes the face of Emmett Till. I made a point not to show what was done to him by those who murdered him, but what happened to him as a young child is no different than what is happening here in this picture. These young men here are teenagers. This is a song here by Billie Holiday called "Strange Fruit," and the song is about lynching. I don't know who is unfamiliar with the song or who is familiar, but I do know that I've met people who sing the song and who think that it's just a nice song and don't understand the meaning. The meaning was to point out how Black people were treated in this country and how Black people were entertainment when it came time for lynching. Lynchings are mutilations. They're when Black people were burned, beat, tortured, dismembered, and murdered. And Black men, women, and children were dragged from their beds for this to happen. And this map shows what happened through 1950. So we're not talking about something that happened in the 1800s only. We're not talking about something that happened in 1910. We're talking about something that happened when there are individuals who are still alive today who experienced watching lynchings. So the Spanish flu, we all know about the Spanish flu. I think many people have heard incessantly about the Spanish flu. But what you may not have really thought about is how the Spanish flu really overlaps with so many other important occurrences in history. So the Spanish flu happened between 1918 and 1920, but World War I lasted during that time, and you had many African American soldiers returning home from the war during the Spanish flu. And Black men were over fighting for the democracy of the United States. They were helping to secure that America could be safe, but they returned to a place that still didn't value them as the veterans that they were. They treated them as Black men who didn't have the right to have freedom and opportunity. Along at the same time was the Great Migration. We're in Chicago, which is one of the recipients of many of those who are relocating from the South to the North. You see in this picture that there is a man who's got his suitcase that says he's a Southern Negro, he's traveling north, and in the background there's a lynching. So he was fleeing the South to come north and hope for better wages, better opportunity, in a time when it was believed that coming north there would be less racism and better treatment. But in fact, that did not happen. As I showed you on the last slide, lynchings happened in the North too. And during the Spanish flu, Blacks were treated the same as they were in the South. So during the Spanish flu, more than 50 million people around the world got the Spanish flu. There were 675,000 deaths in the United States alone. And the barriers that Black people experienced prior to the Spanish flu continued. So they received health care that was inadequate. They were put in cases where they were underserved. It was not unlikely that Black people were just not given treatment. Their bodies were, as we saw currently, bodies were burned without any thought, and they were often left to take care of themselves. And so even though whites had higher rates of morbidity, Blacks were much more likely to experience higher rates of mortality. Well, if that wasn't enough, the Red Summer, 1919, was named the Red Summer by James Weldon Johnson. And Black people were fleeing the South from lynching. They were coming north. They were returning from the war. They were experiencing the Spanish flu. And around the country, there continued to be an uprising of violence and terror against Blacks. Prior to this, in 1917, in East St. Louis, there was a strike. And the company Aluminum Ore brought many Blacks north in the attempt to break the strike. And so there were 3,000 whites who were on strike. And this became known as the East St. Louis Massacre. It lasted for days on end. Blacks were tortured. In fact, one reporter said that Black skin was a death warrant. It didn't matter if they were children, if they were adults, if they were women. The goal was to murder and torture. These pictures here actually took place in Chicago during the Red Summer. These riots swept Chicago during 1919. I gave you this picture here of Lake Michigan because we all live here. I'm sure many of us have gone to the lake and saw it as peaceful. But the lake was also not immune from the terror. So in 29th and Lakeshore Drive, right here at this location, the body of Eugene Williams, which really kind of started the Red Summer, was found. And for many people, the lake became a place that was a place of terror. And what happened was young Blacks crossed the color line that existed in the lake, and that led to state-sanctioned violence, and became state-sanctioned violence because the police engaged, the National Guard engaged, and so Blacks once again were terrorized, and being terrorized during a time when they were experiencing a pandemic. And at that time, the worst pandemic that we'd ever experienced. The Great Depression, we all know about the Great Depression. I use this picture because I think it shows the irony of what we live in the United States here. We have this ad here of the world's highest standard of living, and yes, the Great Depression impacted whites, but it impacted Blacks differently. The stock market crashed in 1929. The overall unemployment rate skyrocketed from 33% in 1931 to 1932, where it was 15%. But for Blacks around the country, it skyrocketed, and in some places up to 80%. It was 60% in Detroit, it was 60% in Philadelphia, 70% in Atlanta, 75% in Memphis, 80% in Norfolk. And part of how this happened is that as white individuals were losing their jobs, Blacks were forced to leave their jobs to make way for whites. And so as white people were struggling but continuing to do a little bit better, Black people were seeing a significant decline in their experiences and their standard of living. That became the seeds for the Civil Rights Movement. So we think of the Civil Rights Movement as happening in 1950s and 1960s, but in fact, the seeds occurred right before then, during the Great Depression. We know that during the Civil Rights Movement, there continued to be terror. We see that little girls were killed. This is John Lewis, who I'm sure all of us are familiar with, on Bloody Sunday. We see there were continuing protests in the 60s about simple things like just swimming with Blacks. During that time, we saw landmark Supreme Court cases, Brown v. Board of Education, which overturned Plessy v. Ferguson about the separate but equal standard. But we also the assassinations of JFK and Martin Luther King and Malcolm X. We saw the Civil Rights Act of 1964 being implemented, and we saw some improvements for some Blacks where more Blacks began to obtain high school diplomas, but we also saw that they were less likely to finish college as more whites were being able to engage in college and graduate from college. So I decided to give you that amount of information on history because, as I mentioned, not only is history repeating itself, but it's the history that for many Blacks, they continue to live with every day because they've heard the stories, they know the stories, they've experienced it, and it continues to frame how they experience both healthcare, education, the criminal justice system, etc. This picture is from the New Yorker magazine. It's the cover from June 22nd, 2020. I have listed here, as they did, the names of those individuals from our modern day who are pictured here. But as you can see, there's pictures here from the Middle Passage. There's pictures from the 1800s. And the goal is to show you that although Black people have moved forward, we continue to experience some of the same things. And when you have patients that walk into the door, it's important that you understand that. You can't treat your patients as if they live in an isolated bubble. There is larger context to consider. So the 21st century, right? Here we are in COVID-19. And you've had the realization for some that racism, which has existed in this country since the beginning of time, is now coinciding with COVID-19. You have groups and individuals, and as you see, Don Lemon and other journalists talking about there are two pandemics, there are two viruses killing Blacks in America. You have COVID-19 that is disproportionately impacting Blacks. We also have racism that has continued to impact how Blacks experience healthcare, the type of care that they get, the access to healthcare, the disproportionate deaths that they are experiencing. We know that for African Americans in this country, there are pre-existing medical conditions that make them more likely to experience COVID-19. We know that COVID-19 has disproportionately impacted Blacks when it comes to employment. They've experienced higher rates of unemployment because of the types of jobs that they're more likely to be mandated to or to experience. They're often in service industries. They are more likely to be called essential employees. They're more likely to be in positions where there's no health insurance. And so that has led to, once again, a revolution. We saw in the 60s and the 50s, the civil rights movement, and now we see Black Lives Matter, which has existed for a while, but get more attention and be more outspoken. We know that, however, there's the counter argument to Black Lives Matter, that Blue Lives Matter, all lives matter, and that people just don't want to get it. And I use that term, get it, really facetiously. People choose not to understand what it means. You know, if you look at these pictures here, you have these two individuals with their signs saying, I would die here today if it meant my children wouldn't have to deal with racism tomorrow. And I think that's a pretty powerful statement, to think that someone is willing to give up their own life to not experience something that for some doesn't exist. We have many in our country who think systemic racism doesn't exist, but we have facts on a daily basis that show us that that is not true. I'm going to end this part of my presentation here with a quote from David Williams, who says that every police shooting of an unarmed African American leads to worse mental health for the entire Black population in the state of which it occurred for the next 3 months. And what I want you to think about is that during our pandemic, we have been staying in our homes, we've been sheltering in place, and we've been forced to watch consistently on our TVs the murder of Black men and women. We've been forced to listen to murders. We've been forced to listen to how charges have not been executed, because it demonstrates the lack of value for Black lives in this country. So I'm going to turn it over to Dr. Day.
Okay, thanks, Enrica. Let me see if I can share my screen. I hope everybody can see that.
Yep.
Good. Okay, so good afternoon. I'm going to reintroduce myself. Enrica's talk was so riveting. It's, yeah, thank you. So I'm Dr. Joseph Day. I'm an associate professor of community health in the Department of Addiction Studies and Behavioral Health at Governor State University. My presentation will view racism through a slightly different lens. The lens or framework that I will use is partly based on the work of Isabel Wilkerson and Dr. Ibram X. Kendi. In her book, Caste, The Origin of Our Discontent, Wilkerson describes the racialized caste system as it exists in the US. For Wilkerson, the hierarchical caste system is much more pervasive and all-encompassing than racism. And it's been a part of the American culture from its inception, as Enrica pointed out. When we think of the system that orders human worth, our thoughts travel to the South in a bygone era. But the caste system is ubiquitous. It has been a part of our past, our present, and quite possibly our future. Most importantly, the US caste system is sanctioned by custom and law. For Wilkinson, your place in the caste determines many things, including your standing in society, how much respect you receive by others. It determines perceptions of beauty and intelligence, and the measure used is the color of your skin. The caste system is more than simply disliking some group. It's an artificial, arbitrary way of assigning value to human beings. The caste system, or the beginnings of the caste system, occurred when the first enslaved Africans were brought to the shores of this country by Europeans in 1619. This is a representation of the US caste system. As you can see, whites are on top, African Americans are on the bottom, and other groups occupy in between. I hypothesize that the devaluing feature of the caste system is operationalized through the social determinants of health. As most of you know, the social determinants of health are conditions in the environment.
Barbara, who doesn't know this?
As most of you know, the social determinants of health are conditions in the environments in which people are born, live, learn, work, play, and worship, and age. And it affects a wide range of health, how we function, the quality of life, the many health outcomes and risks that we encounter. I distilled them into the following factors: the social and community context of a population, the economic stability of a population, the general education levels of the population, the general health outcomes of a population, and the neighborhoods and environments where the population resides. The devaluing nature of the caste system is predictive of the poor outcomes for African Americans on the social determinants of health. Let's look at some numbers. African Americans have the highest rates of poverty. The caste system drives economic instability by reducing opportunities for African Americans, which leads to the decrease in resources. In terms of education, the caste system first denied education, then said it had to be separate but equal, and now has made education only for those that can afford it. Since poverty is high, education is a destination for many African Americans who cannot afford it. And those that can afford it, there are many obstacles placed. Home investment is low because many African Americans lack the initial down payment to invest in a house. The caste system causes high poverty, is responsible for residential segregation and its enshrinement into law, like redlining, that help to isolate African Americans from the larger society. The caste system segregates African Americans in areas with higher rates of environmental toxins and few green spaces. Any urban city's low-income housing development will do. These less desirable places are often near sites that spew pollutants in the air. Chicago's South Side near train tracks is a good example. Or waste buried in the ground. These are called brownfields. Or being near contaminated water, like in Flint, Michigan. According to the National Vital Statistics Report, African Americans have the highest mortality rates. The caste system predicts this increased mortality for African American. In part, we can hypothesize that isolation, exposure to environmental hazards, and increased stress and decreased resources play an important part. The National Center for Chronic Disease Prevention and Health Promotion reports the increased mortality for African Americans extends to all ages, especially for infants. The caste system disrupts the social and community context of African Americans, leading to increased community level susceptibility, which results in increased level vulnerability. I hypothesized that the devaluation on both the individual and population levels, along with the physical and social isolation and lack of resources, lead to health disparities and worse outcomes for African Americans. The caste system provides the cauldron of factors resulting in African Americans having more chronic diseases, receiving lower quality and less appropriate care, dying earlier and at a higher rate, and more often than other populations, even when insurance, income, and age are comparable. At the bottom of the hierarchy, with low human value, African Americans have been used by the medical community without their consent. Let's examine a few cases. Most of you know about the Tuskegee trials, which were initiated by the US Public Health Service in 1932. This was a study of untreated syphilis in African American males. The study was conducted without the benefit of patient-informed consent and was forced to terminate in 1974. Another example is Henrietta Lack. Doctors at the Johns Hopkins Hospital in Baltimore, Maryland, had taken samples of her cancerous cells while diagnosing and treating the disease. They gave some of that tissue to a researcher without her knowledge or consent in the laboratory. Her cells turned out to have an extraordinary capacity to survive and reproduce and became the source of the HeLa cell line. How about James Marion Sims? He is known as the father of gynecology for his breakthroughs in perfecting methods for repairing vaginal fistulas. In addition, he is credited with the first successful gallbladder surgery and the first successful artificial insemination. The success of his work emerged from experiments on enslaved Black women without the use of anesthesia. Given this history, it becomes clear why trust in the medical community has been eroded for generations in the African American population. The caste system has driven the lack of trust African Americans have in the healthcare system and in healthcare providers. Without trust, they are less likely to initiate and go to an appointment and less likely to follow the instructors of their caregiver. Every aspect of the African American experience with the healthcare system, from the first contact to receiving results of a doctor's visits, is influenced by the devaluing nature of the caste system. There may be fear on both sides. The provider may fear being in close proximity to an African American, and the patient may fear that they are not understood, or they thought that they may think that the physician thinks they're ignorant, or they may lack the finances to purchase prescribed medications. Dr. Ibram Kendi says that one should be self-reflective of race in all encounters. The opposite of being a racist is not being a racist, but rather being anti-racist. This is an active process. Empirically, when it comes to the medical community, it should acknowledge uncertainties, distrust, and cynicism and address them. Be aware of the racialized caste system and its impact on healthcare. Expose and emphasize to medical students the intricacies of the social determinants of health. Understand that non-compliance should not be a catch-all phrase for interactions with African American patients. And ultimately, healthcare providers need to be self-reflective of their contacts with all patients, but especially of African American patients. You should realize that your actions and inactions can affect patient outcomes. Henrika?
Thank you, Joe. So, Okay, so more of what to do. So I think the first thing that people should think about is learning what white privilege is and how to be aware of your own privilege. You know, there's often this assumption that if someone grew up poor or they have experienced challenges, that they don't have white privilege. But the fact is, if you're white, you have white privilege. If you can walk through the world and not be questioned about what you earned or where you are and what you have, there's white privilege. If you can go to bed at night and not worry about a loved one being potentially harmed by the police or someone else, then you have white privilege. It's important to really understand what is structural violence and what it is, why it matters. You know, we're really fortunate at UIC to have SHARE, and at the crux of the work that they do is structural violence. I would encourage you to look at what they produce and look at the kind of work and have a better understanding of what structural violence is. I think it's important that you learn about the role you play in the ongoing pervasive existence of racism and how you benefit. You know, we live in a country that was founded on racism and white supremacy. The fact is that if you are white, you are racist. It doesn't mean that you are a horrible person, but it means you benefit from the founding of this country. It means that you benefit from not having your color of your skin be why you were judged and what determines how you're able to proceed in life. It's important not to turn a blind eye to state-sanctioned violence and racial terror. We literally had a debate 2 nights ago where our president failed to disavow white supremacy. And I would dare anyone to try to find an excuse, like I have seen by some of his colleagues, to say he had misspoke. He didn't misspeak. He failed to disavow white supremacy. What that means is he failed to disavow state-sanctioned violence and racial terror, and in fact encouraged it. And so if you fail to understand that, then you have to really take a look in the mirror and think about your perspective and where you're coming from. And you want to remember that it is a privilege to learn this information versus live it every day. Black people live with racism every single day of their lives. They don't have to learn about it. They don't have to read about it. They don't have to take a class about it. It exists. And then finally, what should you not do? You shouldn't use the I am colorblind, I don't see color approach with your patients or any Black person. You know, oftentimes people think that that's a strength because it means, oh, I see everyone equally, I treat everyone equally, but the fact is we don't live equal lives. The fact is Black people don't have the pleasure or the opportunity to live in a colorblind life. By acknowledging color and by acknowledging racism, you not only do you acknowledge the challenges, but you acknowledge the beauty of their lives and you acknowledge the things that they're often proud of. So it's important to acknowledge the challenges and the strengths. You want to make sure that you don't invalidate or require proof when a Black person shares their experiences with racism. You don't get to tell someone whether they've experienced racism or not. What they experience is their experience, and it's important that you understand that. You also don't have the right to determine that because you know what 1 or 2 Black people have experienced, that you understand all Black people's experiences. We are not one group. We're not a monogamous group. We are not a group that's homogeneous. We have different experiences in the world. Our ancestors and we arrived in this country different ways at different times. We span the range of educational levels, academic opportunities, where we live, how we live. And so it's important, just as you would want to be treated as an individual within a larger context of a group, that you treat Black people the same way. And then finally, it's not okay to expect a Black person to educate you about racism, how to become anti-racism, how to become an anti-racist, even if they're your friends. You know, you wouldn't ask someone who has experienced trauma to repeatedly relive and talk about their trauma with you because you want to learn from it. If you ask, it's okay for them to say no. It's okay for them to say yes, but they have a right to decide and determine what their answer is. And you should not then decide, well, they wouldn't tell me, so I don't need to learn. Your responsibility is to continue to try to learn, and they have the responsibility to themselves to make sure that they can go through their lives every day and not bear the burden of educating someone else about an experience that they didn't choose to have. So finally, I wanted to just mention, I know that there's a White Culture Black Lives chapter at UIC. I don't know how active they are, but I wanted to remind people that they exist. As many of you know, there was a call out a few weeks ago, and this is a picture actually from UIC. I made a point to pick this one so you can see the UIC picture. Their vision is to safeguard the lives and well-being of patients through the elimination of racism. And their mission statement is to dismantle racism in medicine and promote the health, well-being, and self-determination of people of color. And so if this is something that you are committed to, I would encourage you to get involved with this chapter and make it move forward. As I said, I don't know if it's active, but if it is, find it, get engaged. And if it's not, commit to reactivating. And then I want to end with this. Black people are not victims. We have survived in this country despite the Middle Passage, enslavement, and the numerous other attempts to make us the footstool that everyone who is not Black or American Indian and Native American, who are survivors of numerous attempts at indigenous erasure, had the privilege of using to reach a ladder so they can climb unfettered and accomplish the American dream. So if you are silent, you're complicit. If you fail to demand change, you're giving approval. And if you fail to demand justice, just know you're guilty and you are supporting injustice. For those who want to know more about the contents of what I talked about, here is an article that I had published last month that talks about this much more in depth. And I just want to thank everyone for giving me the opportunity to share.
Thank you, Dr. McCoy, Dr. Day. That was very enlightening, I think, for a lot of us. I just want to say personally, I think even with the events that happened this year, a lot of us have looked to find out more and get more education. And then a lot of us have talked about history that we've never even knew of. Even at my age, gone through how much schooling, where is this history? I think that's a big question mark. And I think that talks such as what you both gave is something that we all really need to know more about, the history of our patient population and what they've experienced in the past. I really appreciate you talking about that. I do want to kind of throw out a question to you that's been coming in through the chat regarding our patient population. This idea that patients are either non-compliant versus non-adherent. I think what I'm hearing in the chat is that both of those terms may imply that the patient is not doing something right. Could you both comment on those terms in the context of what you presented?
I mean, I will go first and say I think it's important to understand that those terms communicate power, and it's important to understand the power that you have when you walk in the room. You are a doctor, but your job really should be to be partnering with your patient so that they can improve, not to force them to do something because you know or think it is best for them. People come to doctors because they want to get better, but we have a long history in this country of not helping Black people to get better. I will say I teach research. I'm a strong believer in vaccines, et cetera, et cetera. When there's a COVID-19 vaccine that I think is backed by science, I'll be in line to get it. But I will give you an example. A few days ago, Donald Trump's White House decided they were going to ship vaccines to every HBCU in the country, or not vaccines, tests to every HBCU in the country. And I will say my first response as a highly educated African-American woman who teaches research on a regular basis, my response was that if you want Black people to not trust something, that's the way to do it. There is history. There is a history in this country, as Dr. Day pointed out, of using Black bodies to experiment on, to allow Black people to remain sick despite having treatment. And so adherence and compliance imply that only you know best. And therefore, oftentimes it means that you don't listen to what your patients have to tell you. I'm a social worker. I believe people are the experts of their experience. And I think that part of that as being a patient is you are an expert in the pain that you are experiencing too. And you have to have someone who's willing to hear that and work with you for you to be able to be willingly engaged in treatment. So I will let Dr. Day share his thoughts.
Well, I piggyback on what you say, Enrica, but when I hear terms like non-compliant and or adherence, what I don't hear is relationship and collaboration. And I mean, if you want to improve patient outcomes, the quickest path is by developing a relationship with your patients. Then non-compliance and adherence become words that you don't even use. They don't come to mind. I understand that most of you only get 10, 15 minutes with your patients, but you got to figure it out. There is no magic bullet for this. You need to develop a relationship with your patient. I like the term therapeutic alliance. Yeah.
That's great. Thank you. I think that clears up quite a bit. And those are certainly common words that we see we hear every day. And I think what I'm hearing is that we need to not necessarily use those words, but understand the context of why we're not having alliance, and better understand why our patients may or may not be able to access or better understand their distress. One of the other things I wanted to throw out, I'm looking through the chats as well. And Dr. McCoy, you mentioned this in one of your slides. There was a quote about how there's trauma within 3 months after we witness. What I'm always sort of disheartened by is that for maybe the non-Black population, and I use that very generally, it's almost a desensitization where that feeling of the shock kind of goes away. And I'm wondering, I know what are, I guess, some of the things, we're trying to keep the sort of the movement alive, I guess, but sometimes I do feel like it sort of dwindles down and we move on our own, accord with COVID-19 and so forth. So are there certain things that you feel that we as a society or as a group, could be doing to keep this alive if we're not always the ones personally deeply impacted, but we're shocked?
I think that's probably the biggest problem in this country is that there's a privilege and a luxury to not having to pay attention and to not having to experience. And there's a failure to understand how when one group of people in this country is impacted, we all are. So when you were seeing Black people terrorized and murdered, that just means that there are people with great potential in this country who can't contribute. So it's not happening to you personally in a way that you might identify, but it's happening to you in terms of where we can grow and where we can be in this country. And it's happening just on a level that people are people, they're human. I am really saddened, and that's just a weak word, the one that I can come up with, at how we are willing to sacrifice people in this country through racism, through COVID-19, et cetera, because it doesn't impact me. And, maybe it's visualizing the one Black person maybe you don't know any Black people, so it's visualizing the one patient you liked. But the fact is, it happens to all of us. And if you aren't able to do that, ultimately what you're doing is holding yourself back and holding back your children, their future, et cetera. It's probably not the best answer, but I think if we are in a helping profession, which most people on this call are, then our goal is supposed to be to help our society be better. And that means making a conscious choice to pay attention to what's happening to those in our society who are vulnerable, who are disempowered, who are sacrificed, et cetera.
Dr. Day, did you want to make a comment or?
I think that and Dr. McCoy stated this earlier, if they're beating me up, if there's state-sanctioned violence, then my turn will be coming soon. We all will get a turn. We all will have to suffer if we allow one person to suffer. And we're connected. We need to be thinking about the collective good. And when we stop doing it, we're setting ourselves up for what's going on right now.
Great, thank you. I'm looking through the chat. If anybody has a specific question, or since we're nearing the end, if you'd like to just raise a hand to ask a question, we can take maybe 1 or 2 questions right now from the audience.
see that there's a question in the chat about, does the shock ever get a chance to go away when they just keep coming from all directions, whether intentionally or not? And I'll say for me, the shock doesn't go away. There's the momentary shock, and then there's the momentary, well, what else can I expect? I don't know if Dr. Day has a different perspective, but there's like that 1 second of shock, and then the rest of it is, well, what else can you expect?
Yeah, I think you're absolutely right. And we become desensitized to it collectively. And I don't, it's not about if that's a good thing. It's probably not about it being a conscious thing. It just occurs. And these kinds of conversations are helpful to bring it back to the forefront. We need to be on point. We need to be thinking about it. We need to vote. We need to participate. So.
And I think I just like to say, you know, both your patients and the people that are just and that you know and that exist, you know, it's important that we recognize that we don't know everything about every person's experiences. We really know about our own. And when people come to you with their history and their experiences, you have to let them own that and be okay with that. You don't get the right to tell them that what they know to be true is not true. And the fact is, we live in a country where racism exists. We live in a country that was founded on racism. We live in a country, I have to say, I get annoyed when people say we live in a country of immigrants. No, we don't. We live in a country of immigrants. We live in a country where people were enslaved, and we live in a country where the people that were indigenous to this country were annihilated and basically decimated. And even when we make that comment, we deny the history of this country. And we have to be honest with ourselves if we're ever going to move forward. And every patient that walks into your clinic, your ER, your office, that is Black, and then it's from other you know, persons of color, Black, indigenous people of color, they carry with it generational trauma and history. Yes. And even if they don't consciously know and can't tell you every story, they live with that every day. And the only way you'll have a successful patient relationship is to understand that. And when that appears in your interaction with them, to acknowledge that and to not pretend that it doesn't exist. And if you have a problem with it, it's your problem to deal with. It is not theirs. You have to go out and figure out what you need to do to be a better practitioner. It is not their job to go out to figure out how to be a better patient.
Agreed. And I would add to that, we have to tell the truth to our children. And I don't know about you or most of the people listening to this, but I heard very little about the genocide and the things. You know, some of us think that we will be hurting our children if we tell them the truth. But it's fascinating to me that most of us don't want to lie to our children. So we send them to schools, the schools tell them lies, and it only makes it worse because these children will be patient and they've incorporated these lies into their psyche, and now it's hard for them to admit that being Black in this country is a problem because the myth of this country is that you're just equal and nothing really happened to you and you need to get over it. It's fascinating, but we need to stop and we need to just realize. And the other piece to that argument is that if we get rid of the Columbuses, or if we're honest about the Columbuses, what heroes will we tell our children? Well, how about Jane Addams? I mean, how about Ida B. Wells? I mean, the number of heroes that don't get mentioned in the history books is incredible. We need to rethink how we're teaching, how we are educating our youth.
Wow, that was really powerful. Thank you, guys. This is Alana Bigger. Sorry, I joined. I saw most of it, but I had to join late because of our clinic. I'm not seeing any other questions in the chat. Wait, let's see.
We have
How
one.
do you? Yeah, I just see it. How do you handle it when white people are the only ones leading and centering themselves solely in the work of racial equality or equity in certain spaces?
My personal opinion is that you take the reins away. I have a quote in the article that I wrote. I'll screw it up, but it basically it is equivalent to, you wouldn't ask someone who's watched climbing Mount Everest on TV how to do it. You'd go to someone who's actually done it. And so you don't go and ask a white person what it feels like to experience racism, because they get to watch it. They don't get to experience it. And so you have to be reminded of what your role is in this experience. Are you watching it and wanting to be an ally? Or are you experiencing it? And if you're just watching it, you don't get to be the expert. And you have to be okay with letting people know that. I have no problem reminding people, I am grateful for allies. I'm grateful for people who want to partner in its eradication, but you don't get to tell me what it feels like. And if you don't do that, then you are only giving permission for someone to steal your story and to center themselves in an experience that's not theirs to have.
Well said.
Yes, and I see John Holton has a hand raised. I don't know if that's from now or before. If you have a question, you can unmute yourself.
Thank you. Given what our presenters have just described, I wonder how both of them interpret the president's executive order to stop the presentations
race theory?
Yes. It seems that from what you're saying, that is the absolute opposite of what our presidential leaders should be advocating at this point in time.
I think that we shouldn't be surprised at the attempt to eliminate any discussion of racism, white supremacy, critical race theory, etc. We live in a country that has immersed itself in denial. We've experienced more intensely the last 4 years of an attempt to pretend like these things don't exist. And I'm not surprised. It's certainly not going to impact me and the work that I do. I certainly will understand when, I guess, someone they work for the federal government and they can't have that conversation at work, but they can have it in private. So I'm not surprised. I think that people should acquaint themselves with what that executive order is, and they need to acquaint themselves with what critical race theory is. Find out who those authors are, Derek Bell, Kimberly Crenshaw, et cetera, and learn what it is and to see what it is that makes it so threatening. What makes it threatening is that it's truth. And become acquainted and, I guess, become educated about it.
Good point, Henrika. Education's powerful.
Thank you. We will have this presentation taped. We'll send it out to those who were not able to join us today, and it's spread wide throughout the College of Medicine. I want to thank Dr. McCoy and Dr. Day for such a powerful talk today. You know, you guys definitely dropped a lot of knowledge, and I hope that it was as well received from the others as it was for myself today too. So we invite you to come back anytime you want to give us some more knowledge. And with that, we're going to end the presentation.
Thank you so much for having us.
Thank you.
Yes.
Thank you for coming. Thank you for presenting. It's a wonderful talk.
Yes.
Thank you for presenting. Thank you so much.